Good morning. Good morning to all of you. Mkamorga. Uh, Thank you all for coming and welcome to this morning public hearing. This public hearing is in regards to the Governor Communication 11-33, nominating Ms. Maria Marfel for the Directorship of the Department of Health Services. This particular communication was assigned by the Speaker to the Committee of Government Health and Welfare. So our committee will be facilitating our public hearing this morning, and we will be opening up questions for other members and as well as principal witnesses to address whatever question that may be posed by the members of the legislature. So welcome and good morning to all of you. Before I give the floor to Governor for his opening remark, I would like to, on behalf of the Committee of Government Health and Welfare, we want to thank you, Governor, for your tireless effort of trying to fill the vacancy that we have at the department, and we thank you for that. We know that the department is in dire need of leadership to move the department to implement the priority of the administration and the state. So I thank you very much. At this point, I will give you the floor for your opening remark, and then we'll move on from there. Thank you, Governor.
Thank you very much, Mr. Chairman, and good morning to everybody. You correctly pointed out that this department is a large department and it's a challenging one. I think in the executive branch we have two large departments, Department of Health and Education. And they are challenging departments, and I think we've got the right person to help us in working with this particular Department of Health. As we all know, that at times when the issue of being large is always nice, but sometimes it has a downside too. In that, and I'm not saying that our departments here. I'm speaking particularly in terms of our department, but I'm speaking in general, corporation and whatnot. When an entity is first created, it's created for a certain purpose, and then as the entity grows big, at somewhere in the middle of the process, it sort of like changes focus and start to concentrate on its own growth, and maybe lose sight of the basic purpose for its creation in the first place. We've seen this throughout the whole world. I mean, there are organizations, large organizations that does this. But anyway, I digress. Back to Department of Health. You're right in pointing out that that's one of our big departments, and it's a challenging one. And I think we have with us Maria Marfel, who has been in that department for a little over 34 years. 34 years is I think, a fairly good time to understand the department in and out. And within that 34 years that she's been with the department, 8 years of it was spent as a laboratory head technicians. 8 years of that was a laboratory manager. And throughout her capacity as a laboratory manager, she was able to, she's responsible in managing the laboratory administrative functions, operation and capital budget, and appraise personnel in accordance with performance standards in biochemistry, microbiology, hermatology, and serology blood bank, and parasitory. There are a lot of scientific words here that I'm having trouble understanding and pronouncing. But anyway, as you can see from her attached resume accompanying her nomination, that she has a wealth of experience in these areas, and it will take time for me to go through all of that. And prior to working with the coming to YAP and working with the hospital, she's been uh, spent 2 years in northern Michigan hospital where uh, she was doing her internships, and also as far as her education is concerned, she gets her bachelor's degree in public health education and medical laboratory science at the Michigan University, and that's in 1981 to 1984. And then in 1981, before she went to Michigan University, she got her Associate of Science in Biology at this is Alpena Community College in also in Michigan. And I will be, as I am doing injustice for going over her resume together with you, because I'm sure you have all of these, but I'm just spewing it out for the purpose and benefit of those who does not have access to this. But she has an extensive resume before you. And as we go through these questions can be asked, and if there's somebody who would like to maybe throw in some questions outside, I feel confident that this is the right person for us to use for that department. And with that, I present to you, Maria Marfel. I turn the chair back to you, Mr. Chairman.
Kumgar Governor, and for the benefit of those who are listening to us this morning, let me introduce our principal witnesses who are here this morning. We have the Governor, Charles Seng, Lieutenant Governor Itmay, and the Governor Chief of Staff, Paul Ayin, as well as the nominee, Ms. Maria Marfal. We also have with us Vice Speaker Ted Rutun, Vice Chairman Anne-Marie Lamar, Floor Leader Fong, uh, Vice Chairman Gabriel, and Chairman Mafal, as well as Vice Chairman Leon, and myself, Vamo. So, Kamurga. Uh, Before I give you the floor, Barfal, if you have anything, your opening statement, uh, before I give you that opportunity, I would also want to thank you for your leadership and your professionalism by leading Yap State during the hardship that we went through for the past 3 years, and through your knowledge, we were able to move forward, and hopefully we can now call this time back to normal compared to 3 years ago that everything was very quite challenges. So I'm sure the people of Yap are very thankful for everything that you have done uh, to move us to the next step by putting this COVID-19 behind the burner. So thank you for that. Do you have any remarks that you wanted to say at this time before we move on to Q&A? That this is the opportunity. Thank you.
Thank you, Mr. Chairman. And I want to thank the members of Legislature, also the Honorable Governor Chieng and Lieutenant Governor Itimay. I'm grateful, and also it's an honor to be nominated for the position. And I'm here. I hope to be able to respond to your queries to your satisfactory this morning. Thank you.
Thank you. Members, anybody have any statement before we move on to? All right. Um, well, thank you, Governor, for going over the CV, and we all know Maria Marfel, and this particular nomination is pretty much different from the previous ones that you've nominated, because some are new to the post, but Maria has been with the department for many years, and we know that she will not be learning the ropes. I'm sure she knows the department inside out. So my very first question to Maria, I know when you were asked to take on this particular task, and it's quite a challenging task on top of what you're currently doing. And I know you have been thinking about it for quite a while. Uh, but the committee wanted to know within the first 100 days, that is three months and couple of weeks, what is your objective? What are the things that you will be doing within this time frame? Hopefully changes can be seen, can be felt, and that's basically what I want to hear from you. Thank you.
Thank you, Chair. Yes, I have been giving some thoughts to what I would need to do if given the opportunity. I feel that there needs to be some reorganization within the department. Throughout my years, and especially during the pandemic, I really realized the gaps and weaknesses in certain divisions within the department. And I'm not saying that individuals or divisions are not operating, but I want to use an example as the laboratory. We had to take on with the accreditation process that we are going through. We need to reassess our situation and identify the gaps, not to point fingers to an individual or a group of people, but just to identify the gap for improvement purposes. And so I feel the same should be extended if I given the opportunity. And I have already expressed this to the core group at the hospital, that I cannot ignore this process because I see that it works and it has worked for the laboratory. So it's just a matter of expanding it to the department level. It's not going to be easy, but it will be something that I think time will tell the outcome, and I believe it will work for YAP. Kamukan.
Come for members. Okay. Okay.
Thank you, Marfel. Greetings and good morning, Governor, Lieutenant Governor, Chief of Staff, colleagues from the Legislature, LC, and especially to you, the nominee. I just want to again underscore the commendable statements from the chairman of the GHW. There is no doubt in looking at the bio data and seeing, having to see you work over the years
we've worked together. I I was in the executive branch. We had our share of time together. So um, I know that you know the operation, what it takes uh, for the hospital to be able to run smoothly. And we've run through challenges so many times. You were there. You've delivered us out of the challenge of the COVID. You've really came through with that. Um, so um, I'm just going to really limit my question to maybe a one, if any, than two, because I have no doubt that you have what it takes to be the director if you were to be confirmed. Um, just one simple question. Should I know that you've successfully over the years brought our laboratory and ancillary services division, to a very high ranking. It's been rated really good because of you. And uh, if you are to be the director, should I be worried? Should we be worried that there will be a void in our lab because you're moving away to become the director? Can you kind of give us some explanations on why we should feel comfortable? Because we really know that the lab is an important part of the hospital, and we don't want to lose that if you were to move away. Thank you.
Go ahead, Marfel.
Thank you, Chairman. Yeah, I feel confident that the laboratory personnel now can step up and do the job. And I'm saying this because I know my colleagues across the region have asked me numerous times when I'm attending meeting away with them, and they said, why is it that all the labs in the region complain because certain segments of their services stopped simply because the lab manager is away? But we realize that YAP operations still continue on. It's just a matter of uh, making sure, training the staff, making sure that they can take on the job. One of the thing that YAP initiated, and I know some other labs in the FSM have not started yet, that is cross training. So when I joined the lab, I realized that when someone go on sick leave or annual leave, that segment of the function of the lab will just come to a stop because there's no one else who can do the job. So basically in the laboratory, we have each of the senior technicians in charge of a section, which means they go to the training in that particular area, and they come back and do training to other staffs. But everyone else have been trained and certified in all of the sections to do the routine duties. And that's why it allows us to do rotation if need be. And so I feel confident that the current staff, and we are still building the new ones, the new hires, and also those who are at the medical lab technician level 1. We're still building them up, but they are very capable. And to add, I will just be on the other side of the wall. So while I'm there, I will still continue to support them. Come on.
Kumgar Marfel, any follow-up? Marf, go ahead, Chairman Marfel.
Kumgar Chairman, Kumgar Governor and Lieutenant, Kumgar Marfal. This is this one is not really a question for you while you're acting director now, but this is an ongoing situation that I want to get your take on. and how we can remedy, fix. With our last audit, it showed from the hospital, the HS, that one of the things you were cited on was keeping expired medicines uh, in stock, even a year. That's what they were saying. We can still use these things when we had the hearing on it. And and now on the radio every morning you'll hear this klaxon, clong, clong, and then they're talking to us about this expired or this bad medicine actually that has, I guess, been given out to the public, and now there's worries because it is potentially fatal. People could die from this. And it was from my little research by asking the GH people, how did this come into the midst into our community? And I guess it comes something from national during the COVID, but it's been given out, and now we're realizing there's an issue there. And also for me personally, when during all these infections, when I had an eye infection, I came in and the doctor on duty, the night doctor, told me I could use this eye drop, but it had been expired for a year. But he gave it to my decision making for me to decide if I want to put this thing in my eye that's been expired for a year, and so that is a big concern. And I know you've been part of some of these other meetings when and even the when we were talking about that audit. I'm sure you were in the room. We were talking about this. Is there now that you're acting director, and is there, especially with what's on the radio now, is there plans on how to fix this? I know we're low on supplies, so maybe that's why we're going back to expired medicines. But that's just a worry. That's why I threw that out there. Come on.
Okay, thank you, Chair. Thank you. That's a very valid question. And it's been quite challenging, especially during the COVID time. But I have to admit that even prior to that, we oftentimes have to use expired medicine. That is a priority on our list, especially now that we encounter the issue that you mentioned. One is we really need to improve our inventory and procurement system in the hospital, and those will be looked into and see how we can remedy the issue. And secondly, and this is out of our control, basically, is the challenge with freight. Most of our supplies have been stuck in Guam, including laboratory supplies, especially the refrigerated supplies. The United consistently refused the vendor to book those. And because of the fact that they're refrigerated, they need to be shipped as soon as they brought to the cargo. Otherwise, those products are going to be lost. So there's a lot of factors that involve in this. However, there are ways. I'm sure there are things that the hospital can do to improve the system once the flight resume its normal services, and it's really basically inventory and procurement needs to be improved. I have to say that when we talk about quality services, it really comes with a cost, a price. So I'm saying that because the budget will have to go up. Even now with laboratory, we're getting closer, hopefully, to the end of our process where we will be audited. We will receive an internal audit first to see how prepared we are before the international audit committee comes into the audit in the lab. But inventory is something that they will look at. They look at all aspects of operations, and so we there are measures in place. For instance, in the lab, if we cannot do without, there are certain things that can be used when expires, but there are measures that we need to take in order for us to validate that those particular reagents are still working. So when it comes to expired medicine, there are certain medicines that cannot be used when expired. But there are some that can be used, but during a period of time. And I cannot go into specifics on those because I'm not a pharmacist. So I will leave it at that. But needless to say, DHS needs to make sure that we have in-date products for our patient. And I'm sorry about the incident that you are sharing regarding the eye drop. I'm not aware of that. But unfortunately, it's given to the patient to make the decision on whether to use the drop or not. So, yeah, that's all I can say about that. Thank you.
Follow up, Chairman. Go ahead.
Comrade Chairman, and I don't want Comrade Marfel, I don't want to come across as I'm being antagonistic here. I know from our conversation during the last administration, I was one of the people asking you if you could step in as acting director when we were going through so many changes, because I saw that we needed it, but you had your plate full with what you were doing with the lab. So I am full support. Just that these are things that I feel they're on the table, and we need to. This one is also part of that expired issue. Currently, the way our Consumer Protection Act is worded, that law is worded, it's DHS and public safety who will check retail stores for expired goods and medicines, things like this, and do the reporting and things like that. In my personal experience, two of they're a chain of stores. Two of these stores have been selling expired foods, and our state sanitation doesn't. I don't know exactly their part, but some of these things have been expired since 2022, but they're still on the shelf. So I would tell the cashier, please remove those, put them over there, put pet food or something on the side. Don't leave them in the chill for people to come and take as beverage when it's expired. Maybe the different things they have broken down into their that it might be have adverse effect on a person's digestive system. So that's also something that's currently going on, and I think our state sanitation, which is under DHS, it's not really keeping up. And please, these are just worries I have, and I'm just raising them so that they can be looked at. Since you're talking about doing some kind of review of functions and maybe reorganizing, and maybe even the personnel might need some reviewing, like a job audit even. Um, uh, Part of that, in conjunction with the people who are doing the job, this is maybe not even a question, is another observation I've had with when we have patients from neighboring island come to be medevac or referred here for health services, they are given food vouchers. There is a food voucher system that we have, and but they're only supposed to go to the local markets where buy local produce, fresh produce, fish, these kinds of things. They can't take it to YCA and buy beer or anything. It's specific to these things. Now, that's a great program, I think. Now, a problem I've seen with that is when I visit these markets and I see there are the pile of food vouchers there, and I go through them, the one at fish market, just to see what people are getting. Oh, it's good, it's fish, it's this. The problem is it's only one person whose name is on every voucher, the one receiving these goods and services, these products, this fish. One employee at the hospital, high up, So my reasoning behind that is for every 10 pieces of fish that he gets for somebody from another island, not his island, he's maybe keeping 3 or 2 and giving some. These are some of the issues I'm seeing there, and it's too much. That's corruption in the government. Why can't you give the voucher to the patient and the family that they're staying with here to go get their own food instead of the deputy director of DHS being the one to do that all the time? Come on. That's just things for your knowledge. Come on.
Comrade Chairman, Nominee, do you want to comment on that, or thank you?
Comrade Chairman, yeah, I'm sure there's a lot of things that needs to be looked into and take care of. Mentioning about the food voucher, I also realized at one point in time that sometimes there are people who are referred from our island here and finish their treatment, but they decided to stay on, but somehow they're still on the plan, which I think should be looked into if once the individual, the referral patient finish their treatment, then they should go back. Should they decide to stay on for personal matters, then they should be off the program. So I'm sure there are more than what I know and understand about the program, but thank you for bringing it up. We will look into that. Regarding the store inspection, I know the EHS is under the state public health program, but we also have the national sanitation program, which I believe they coordinate to some extent. And so that will be looked into and see what we can do to improve the services in that area. Kamukha.
Comrade Marfel, go ahead, Governor. You have the floor.
Thank you, Chairman. I'm hopeful that there are two parts of the question that Chairman of JSW, already put out. One, a medication being expired, and the other one being toxic. Okay, we've addressed the expiration part, and that's quite easily seen because of the dates on these products. But the toxicity, well, the toxicity or whatever the freaking there is that it's hard. That's the part that I'm going to speak of a little bit of to now. If I have confidence that Marfel can handle the Department of Health with no problem, and so when that happens, I'm working with the national government now, but with your assistance, perhaps maybe we can beef up a little bit that effort to try to see how we in the FSM can prevent this type of inflow of medication. This is a medication, but what you've been hearing on the radio now is one that was created in India and was distributed throughout, and nobody detected it until somebody from Australia pointed out, and now it becomes a concern, and we're trying to grow it back from the from without the society. And it has been that we've been working with CDC, as well. FSM has been working with CDC as well as FDA, but it's quite obvious that some of these are going through the net without being detected. And so, with the efforts of the hospital and us, our administration, working with the national, perhaps maybe we could figure out some other ways to try to minimize this, but it's quite challenging. It's an issue that's quite challenging. We know now that fentanyl has been permeated throughout the United States through the southern border, and sometimes the uh, Department of Health is having problem trying to curtail some of these toxic drugs being disseminated. So it's a big challenge. It's going to take some time to address if it can be addressed. Thank you.
Comrade Governor, any question from Vice Speaker? Do you have anything? Go ahead, Leon.
Thank you, Chairman, and good morning, everyone. First, I just want to thank the nominee for her decades of service to our health services, which is very much appreciated. Also, note on her CV that she's currently serving on some organization or board, and mostly she's chairman for the Micronesian countries or LabNet. Currently, the incident commander for COVID-19 for the department, our department, and president of the Association of US API. I don't know what that stands for, but US API laboratories. So I'm just wondering if you accept or if you're confirmed that would that compromise your or jeopardize your ability to continue to serve on this? And I say you're on the lead for most of this group, and I guess that's a testament to your ability to manage and lead. I'm just wondering if this would compromise your ability to continue to serve on this board and committees and associations.
Comrade Vice Chairman, go ahead, nominee.
Yeah, thank you, Chair. So the president of the AUL is really the Association of the U.S. Affiliate Pacific Island Laboratories, which comprise the six affiliate countries, and there are 10 labs. Basically, I kind of declined the offer back then. In 2015, or 2009, I became the president, and I did that because of the fact that I realized I have to be frank. I was not getting support with the request that I was asking for to improve the lab. And so I personally felt that if I put the YAP Hospital Laboratory on the map, then I will get the support. So I took on that position. And we developed the bylaws and everything. And actually the association, was established and functioned. After 2 years, they asked me to stay on. I refused because I then was able to get some attention from outside of the FSM. And I wanted to make use of those offers to start improving our laboratories. And I also reminded the group and the supporting partners that the term of reference for our association was we rotate the presidency for 2 years. So then in 2019, it was a 100% vote that they want me to take on again. Unfortunately, COVID hit us. And so, but it was, I think, a positive. I felt it was a positive thing for YAP Hospital Laboratory because we were getting a lot of support. Yeah. For the LabNet chairperson, that was just established late last year. And that was established by the Pacific Public Health Surveillance Network with their headquarters in Fiji. And basically the reason why I was elected to be the chair for the Micronesia region is the fact that I'm the president of the AUL. These are some of the things that I want to pass on to my successor in the laboratory, because we need to support them to grow and also learn the rope and continue this kind of development in the FSM as well as YAP state especially. We have a plan, part of our lab development plan is to establish a training laboratory here at the hospital. We know where hospital has, a severe shortage of health professionals. And I believe we can teach our own people. We don't need to get somebody from outside. Of course, we do need experts to come in and assist us, but we need to learn to stand on our own. So I think the training facility at the lab with hands-on, and we've already established the academic aspect of this for the laboratory in particular. We can train people on site for at least a year. They will become eligible for the Pacific Pathology Training Program, which is based in New Zealand. It's a collaborating WHO program. In earlier, I don't recall the year exactly, but I was sending staff there for training. Now the program is online. It's a 2-year program, which I was part of it to establish and offer our people in the FSM, in the region actually, because even some of the accredited laboratory in the USAPI, like American Samoa, they still send their laboratorians there to earn this qualification. So once the lab technicians earn the 2-year diploma in medical laboratory science, we can support them to take on a full scholarship by the Australian Pacific Scholarship Award. And it used to be a 4-year scholarship, but we worked it out with the support of PIOA and other supporting partners in the region. We kind of pushed that from the AUL Association because of the fact, and it really affects the Northern Pacific laboratorians because of our educational level when we graduate is a bit lower. So when they go to Fiji National University, a lot of them fail the medical lab science course. So what we did is we, with the support of other international organizations, they helped us to convince the Australian scholarship to give us add another year to the scholarship. So we have a 1-year prep course for these people who go out there, and then enter. If they pass the 1 year, they get a certificate, and then they automatically become eligible for the 4-year. Having said that, we do have a candidate in the school now, which she will be graduating end of next year. So yeah, we are expecting her to come in and fill one of the positions in the lab. I hope that's, yeah.
Marfel, any follow-up from Red Committee? Finance, anything regarding financial issue? Nothing? Okay. All right. Okay. I just have two questions for you. Currently, the department have new board members. Would you be able to work with these new people on board?
I certainly will. I have joined, I think, a couple of meetings before I went off island. I think the governing board is a good thing that happens for the hospital. I don't know what others, perspective on it, but I think more heads together can assist us in making sure that policies and other matters, around the HS can be secured in a way that workable for our situation.
Kumar, go ahead, Marfel.
Kumar Chair. Kumar Marfal. Just when he asked the question, it brought up a concern that I've had and people have talked about in the past. And in the last administration, the former governor removed the doctor's fees. That was something that was on. You have doctor's fees, you have encounter fees. These are some of the things that outpatients will have to pay for services, for health services. The one that's still on the books now is the encounter. That's the one that I see, and I've asked them, "What is this for?" Well, I thought they removed the doctor's fee because they're already on salary. Why are we giving them? What is this other fee for? They're on salary. What's this encounter fee for? It's still ongoing right now as we speak. Is it for this half piece of of paper with ink? If that's the case, then that's consumables, and the HS gets their consumables as part of their budget. So these are just some fees that I'm sure for people who, as just regular people who come in, just these little things they might make them hesitate about coming to the hospital. Maybe they can go to CHC, and and the schedule for CHC varies from community to community. So these are some of the fees that I see there, and I question even when you go to the fee schedule for the medicines. Last time we were here, last legislature, 2.5 years ago, and I had a chance to go over the fee schedule. There were even things for like STI and STD. I guess they're the same thing, just different name now, STI. It was still being charged. There was a monetary portion to it, and I would think as a public health concern, we would want to get rid of those things from the community. So maybe these are some things that the board can help with deciding if some of these things are necessary to keep in place, or are they hindering? Because I honestly believe that what the hospital health services is a human right on some level. We have to, even if people can't afford this, we have to find a way as a government to help our people be able to receive the treatment that they need. So just some observations. Kumar, Chair.
Kumar, Chairman Marfel, you want to comment on that or just for information purposes? Thank you. My last question for you. The Government Health and Welfare Committee also deals with the department. We have a lot of offices and departments under our purview. And the members are only 5 months old in office. And yet the Department of Health, the HS, is the only department that we currently receiving a lot of phone calls, not only from the staff, the employees, but also from the people that we serve. And we have talked about it internally. And we felt that it's a internal management issue and concern. So, when we work in an environment, in a department for many, many years, we tend to build a working relationship so that when others step out of lines, we at the higher level tend to turn a blind eye. So my question to you, if this particular position comes with a lot of responsibility and authority, would you be able to reprimand or force someone to step down if you feel that he or she is not doing what he or she is supposed to be doing? Because it's been ongoing for many, many years, and it's like a boil that if we cover it, it's somehow gonna be more infectious. Thank you.
Thank you, Chair. Yeah, I'm sure my staff, if they're listening, they would know the answer. And I've done it in the lab. I I I always let the team know that we should not lose priority, our focus. Our purpose for being at the hospital is to serve the people of Yap. So there should not be any deviation from that. Of course, there will be challenges that will sway us here and there. And I've terminated people before, although I tried to explain why. And I was advised once before that do your part before you can terminate anyone. And I asked the question, what is my part? And I was told, train them and assess them. If they're competent, put them to work and then reprimand them. And if they don't take heed of your advice, then that's the time you do that. So I've done that on a smaller scale. And I think the people at the hospital know me very well and how I operate. I have friends there. I'm sure I also have enemies there, but I try to focus and maintain focus. And I did have a meeting with the chiefs and supervisors before I left Island recently, and I told them that coming back, if I'm given the opportunity to lead the department, then I cannot ignore the way I work. I will bring that practice to the higher level. Yeah, so I know people will not be pleased, and I know I cannot please everyone in the department, but I feel that as long as we maintain focus to service the people of Yap, then we will be on the right track. Of course, with God's help, I'm sure we can make progress. Kamukan.
Kumbar Marfel, and that is quite comforting to hear coming from you, and thank you for that. Any more question from anyone? Floor? If there's no more question, I will now turn the floor over to you, Governor, for your closing statement. Thank you.
Thank you, Mr. Chairman, and thank you to everybody. We've come close to the end of our public hearing, and I think we've heard a lot, and a lot remains to be seen. I'm just hoping that the legislature will do what it has done to the administration in the past and will put this nominee to a test and see, hopefully, to improve some of the things that we've covered. At least that's where will the aim will be. Thank you very much.
Go ahead, Marfel. Thank you.
So before we come to a close, I just want to share that I cannot promise improvement, but I can promise the best I can do. And if given the opportunity, I will certainly need the support from all levels because I'm new to this. I don't know the process. I don't know the protocol. So yeah, thank you.
Kumbar. Go ahead, Vice Speaker.
Yeah, thank you, Chairman. My respect to Governor, Lieutenant, and Chief Staff, and of course all of you guys. I just want to assure the nominee that even though we don't know the protocol, I think you have our support, and especially mine, Kumar.
Kumbar, Vice Speaker. LC, anything from you? No. Okay. Go ahead, LT.
Thank you, Chairman, and my respect to all of you in your house. I just want to add my little voice to what Governor had underscored. It's my full support for the nominee, and my entreaty to you, honorable senators, is to expedite the confirmation of this nominee so we can get to work. And I've worked with her for the past 3 administrations, and I have no doubt in my mind that she will do her best, and we can work with her to move the agenda of the Department of Health Service here in Yap. And also, GEMCO meeting is upcoming soon, and we need a full-fledged confirmed director to be part of the delegation that goes to meet with the U.S. Delegation on the new compact. Thank you.
Kamgar LT. And this brings us to the conclusion of this morning public hearing. And I thank you very much, Governor. Like I mentioned in my opening remarks, we are glad that we're all trying to fill the void at the department, and the committee, CHW, will assist whatever we can to ensure that the appropriate tool is given so that priorities and vision can be moved and implemented according to the vision of the administration. So our committee will work with our legal counsel to put together the public hearing reports, and we'll bring it to the whole body of the legislature to be entertained. So with that, thank you all very much. Thank you, Ms. Maria Marfel and Governor and all the principal witnesses. Thank you all. And this bring us to the close of the public hearing this morning. Thank you.